Question 1. A social worker is conducting an initial assessment with a new client who reports experiencing significant stress due to recent job loss and increased conflict with their spouse. The client expresses feeling overwhelmed and unsure how to move forward. What is the social worker's most appropriate first action? A. Provide psychoeducation about stress management techniques. B. Explore the client's immediate safety and basic needs. C. Facilitate a joint session with the client and their spouse. D. Develop a long-term treatment plan focusing on communication skills. Answer: B. Explore the client's immediate safety and basic needs. This question tests the social worker's understanding of Maslow's hierarchy of needs and the principle of starting where the client is, prioritizing foundational issues. When a client expresses feeling overwhelmed by stress and life changes, the most appropriate first action is to ensure their immediate safety and address any basic needs, such as housing, food, or safety from harm, which might be impacted by the job loss or conflict. Neglecting these foundational needs can hinder any subsequent therapeutic work. For example, before teaching coping skills, a social worker would want to ensure the client has a safe place to sleep tonight. Always assess for basic needs and safety first, as these are prerequisites for effective engagement in other interventions. Question 2. A social worker in a community mental health clinic is meeting with a 15-year-old client who discloses experimenting with illicit substances. The client states, "You can't tell my parents, or I'll never trust you again." What is the social worker's best next step? A. Reassure the client that their confidentiality will be maintained. B. Discuss the limits of confidentiality with the client. C. Contact the client's parents to inform them of the substance use. D. Refer the client to a substance abuse treatment program. Answer: B. Discuss the limits of confidentiality with the client. This question addresses the critical ethical and legal concept of informed consent and limits of confidentiality, particularly with minor clients. When a client discloses information and expresses concerns about confidentiality, the best next step is to immediately and clearly discuss the actual limits of confidentiality, explaining situations where information must be shared, such as mandated reporting for harm to self or others. This ensures the client is fully informed and can make decisions about what to disclose, while also preparing them for potential future actions. For instance, explaining that abuse or imminent danger to self/others requires disclosure, but routine therapeutic content remains private. It's crucial to be transparent about these boundaries from the outset to build a truly informed therapeutic relationship. Question 3. A social worker is working with an adult client who reports experiencing panic attacks in crowded places, significantly impacting their ability to attend work and social gatherings. The client expresses a desire to get back to normal. What is the social worker's most appropriate initial intervention? A. Explore the client's childhood experiences with anxiety. B. Teach the client relaxation techniques and breathing exercises. C. Suggest the client avoid crowded places until symptoms subside. D. Refer the client for a psychiatric evaluation for medication management. Answer: B. Teach the client relaxation techniques and breathing exercises. This question tests the social worker's knowledge of immediate, practical interventions for acute symptoms. When a client presents with distressing symptoms like panic attacks, the most appropriate initial intervention often involves teaching practical, concrete coping skills that can provide immediate relief and a sense of control. Relaxation techniques and breathing exercises are easily learned and can be applied by the client to manage acute anxiety symptoms and begin to regain agency. For example, diaphragmatic breathing can help regulate the nervous system during a panic attack, offering an immediate tool. Providing these skills early can empower the client and facilitate deeper therapeutic work once acute distress is somewhat managed. Question 4. A social worker is conducting a home visit with an elderly client who lives alone. The client appears disheveled, and the home has strong odors and visible clutter, including expired food. The client states they are just fine. What is the social worker's first action? A. Contact Adult Protective Services, APS, immediately. B. Offer to help the client clean their home. C. Assess the client's capacity for self-care and safety. D. Discuss options for assisted living facilities. Answer: C. Assess the client's capacity for self-care and safety. This question focuses on the essential social work principle of assessment before intervention, especially when there are potential concerns about neglect or self-neglect. Before taking any drastic steps like calling APS or discussing assisted living, the first action is to thoroughly assess the client's current cognitive and physical capacity for self-care, their understanding of their living situation, and any immediate safety risks. This assessment helps determine the appropriate level of intervention required. For instance, the social worker might ask about daily routines, meal preparation, and any help they currently receive. It's crucial to gather sufficient information directly from the client to understand their situation and functional abilities. Question 5. A social worker is facilitating a support group for survivors of domestic violence. During a session, a new member becomes visibly agitated and begins to shout at another member, accusing them of being too weak to leave their abuser. What is the social worker's best immediate intervention? A. Allow the agitated member to express their feelings, as it is a support group. B. Terminate the group session to ensure safety. C. Remind the agitated member of the group rules regarding respectful communication. D. Validate the agitated member's feelings and redirect the conversation. Answer: C. Remind the agitated member of the group rules regarding respectful communication. This question addresses the social worker's role in maintaining group boundaries and safety. When a group member violates established norms by engaging in aggressive or disrespectful behavior, the best immediate intervention is to gently but firmly remind them of the group's rules and expectations for communication and interaction. This upholds the safety and integrity of the group environment for all members and models appropriate boundaries. For example, the social worker might say, "We agreed to communicate respectfully, and I need you to honor that rule." This action reestablishes structure without shaming the client, demonstrating the social worker's responsibility to protect the group dynamic. Question 6. A social worker receives a subpoena for a client's records in a child custody case. The client has not provided consent for the release of information. What is the social worker's most appropriate next action? A. Release the records as requested by the subpoena. B. Contact the client to obtain their informed consent. C. Assert privilege and seek to quash the subpoena. D. Provide a summary of the records instead of the full file. Answer: C. Assert privilege and seek to quash the subpoena. This question tests understanding of client confidentiality, legal processes, and the ethical obligation to protect client information. When a social worker receives a subpoena for records without client consent, the most appropriate next action is to assert privilege, the legal right to refuse to disclose confidential information, on behalf of the client and seek to quash, invalidate, the subpoena. This is because the social worker has an ethical duty to protect client confidentiality and should not release records unless legally compelled to do so after all protective measures have been exhausted. For instance, a social worker would contact their legal counsel or the court to argue against the release of records, ensuring the client's privacy is defended. Releasing records without consent or an explicit court order to do so is a breach of confidentiality. Question 7. A social worker is seeing a client for depression. During a session, the client reveals they have stopped taking their prescribed antidepressant medication cold turkey because they didn't like how it made me feel. What is the social worker's first response? A. Educate the client about the risks of stopping medication abruptly. B. Explore the client's specific concerns about the medication's side effects. C. Advise the client to immediately restart their medication. D. Recommend a consultation with the prescribing physician. Answer B. Explore the client's specific concerns about the medication's side effects. This question highlights the importance of client-centered practice and assessment. When a client makes a significant health decision, such as stopping medication, the first response should be to understand their perspective and the underlying reasons for their actions. Exploring their specific concerns about side effects or feelings provides valuable information, builds rapport, and demonstrates respect for their autonomy. For example, a client might have stopped due to severe nausea, which could be managed by the prescriber. This client-centered approach facilitates a collaborative discussion about medication adherence and ensures that any subsequent interventions are tailored to their needs, rather than just imposing advice. Question 8. A social worker identifies a gap in services for homeless youth in the community, with no safe overnight shelters specifically designed for this population. What is the social worker's best action to address this community need? A. Lobby local politicians to allocate funding for a new shelter. B. Advocate for the establishment of a specialized youth shelter with community stakeholders. C. Refer homeless youth to adult shelters, as they are the only option available. D. Conduct a comprehensive survey of homeless youth to document the extent of the problem. Answer B. Advocate for the establishment of a specialized youth shelter with community stakeholders. This question addresses macro-level social work practice and community advocacy. When a social worker identifies a significant gap in services, the best action is to engage in advocacy by collaborating with various community stakeholders, such as local government, nonprofits, and service providers, to collectively work towards establishing the needed service. While lobbying or conducting surveys are components of advocacy, the direct action of advocating with stakeholders is a more comprehensive and effective way to initiate change. For example, organizing meetings with potential partners to discuss funding, location, and services for a new shelter. This approach leverages community resources and expertise for sustainable change. Question 9. A social worker receives a phone call from a client's estranged adult daughter, who states she is worried about her mother and wants to know if she is attending therapy. The daughter insists she has a right to know. What is the social worker's most appropriate response? A. Confirm whether the client is attending therapy but disclose no other information. B. Inform the daughter that due to confidentiality, no information can be disclosed without the client's consent. C. Suggest the daughter contact her mother directly to discuss her concerns. D. Ask the daughter to provide her contact information so the social worker can reach out to the client for consent. Answer B. Inform the daughter that due to confidentiality, no information can be disclosed without the client's consent. This question tests the foundational ethical principle of client confidentiality. When a third party, even a concerned family member, requests information about an adult client, the most appropriate response is to firmly and clearly state that no information, including whether the person is a client, can be disclosed without the client's explicit informed consent. This protects the client's privacy and respects their right to control their therapeutic information. For instance, the social worker might say, due to strict confidentiality policies, I am unable to confirm or deny whether anyone is a client here. This maintains ethical boundaries and legal obligations. Question 10. A social worker is conducting a biopsychosocial assessment with a client who presents with symptoms of depression and anxiety. The client mentions taking several herbal supplements daily for mood and energy. What is the social worker's next step? A. Advise the client to stop taking the herbal supplements immediately. B. Document the names and dosages of all supplements the client is taking. C. Educate the client on the potential dangers of mixing supplements with prescribed medications. D. Refer the client to a nutritionist for a comprehensive diet review. Answer B. Document the names and dosages of all supplements the client is taking. This question emphasizes the comprehensive nature of the biopsychosocial assessment and the importance of thorough information gathering. When a client reports using herbal supplements, the next step is to meticulously document all substances they are ingesting, including names, dosages, and frequency. This detailed information is crucial for understanding the client's overall health picture and for future collaboration with medical professionals, as supplements can interact with medications or impact mental health. For example, St. John's wort can interact dangerously with antidepressants. This thorough data collection is a fundamental part of the assessment process and essential for client safety. Question 11. A social worker is providing individual therapy to a client who reports experiencing suicidal ideation with a specific plan and means, but denies intent, stating, "I just think about it sometimes, but I won't do it." What is the social worker's most appropriate immediate action? A. Encourage the client to focus on positive coping strategies. B. Develop a safety plan with the client, including crisis contacts. C. Hospitalize the client involuntarily due to the specific plan. D. Contact the client's emergency contact to inform them of the risk. Answer B. Develop a safety plan with the client, including crisis contacts. This question tests the social worker's ability to assess and intervene in situations involving suicidal ideation. While the client denies intent, the presence of a specific plan and means indicates a high level of risk that requires immediate attention. The most appropriate immediate action is to collaboratively develop a safety plan with the client, which includes identifying triggers, coping strategies, and crisis contacts. This approach engages the client in their own safety while addressing the immediate risk. For instance, the plan might involve removing the means, calling a crisis hotline, or reaching out to a support person. This ensures immediate safety while respecting client autonomy as much as possible. Question 12. A social worker facilitates a psychoeducational group for individuals recently diagnosed with a chronic illness. During the second session, a member becomes tearful and states, "I just don't see the point of trying anymore." What is the social worker's best immediate response? A. Gently redirect the client, stating the group focuses on education, not individual therapy. B. Acknowledge the client's feelings and invite them to share more after the group. C. Refer the client for individual therapy immediately after the session. D. Validate the client's feelings and explore the point of trying within the group context. Answer D. Validate the client's feelings and explore the point of trying within the group context. This question assesses the social worker's ability to balance group facilitation with individual client needs in a therapeutic and supportive manner. When a group member expresses strong feelings of hopelessness, the best immediate response is to validate their emotions and briefly explore them within the group. This allows the client to feel heard and supported, potentially normalizing their experience for other members, without derailing the group's purpose entirely. For example, the social worker might say, It sounds like you're feeling really overwhelmed right now, and that's a common experience with a new diagnosis. Can you tell us a bit more about what's feeling pointless? This demonstrates empathy and can invite broader group support, fostering a sense of connection. Question 13. A social worker is working with a family where the parents are struggling to manage their adolescent child's defiant behavior and academic decline. The parents report inconsistent discipline and frequent arguments. What is the social worker's first priority in this situation? A. Teach the parents specific behavioral modification techniques. B. Assess the family's communication patterns and family dynamics. C. Refer the adolescent for individual therapy to address their behavior. D. Advocate for the adolescent to receive academic support at school. Answer: B. Assess the family's communication patterns and family dynamics. This question emphasizes the critical role of comprehensive assessment in family social work. When a family presents with complex issues like defiant behavior and inconsistent discipline, the first priority is to conduct a thorough assessment of the family's communication patterns, roles, and underlying dynamics. Understanding these foundational elements provides crucial context for the presenting problems and guides appropriate intervention strategies. For instance, the social worker might observe how family members interact, who speaks for whom, and how conflicts are typically handled. Without this essential diagnostic understanding, interventions like teaching behavioral techniques might be ineffective or even counterproductive. Question 14. A social worker in private practice learns that a former client, with whom the therapeutic relationship was terminated appropriately 6 months ago, has opened a new business in the same building as the social worker's office. What is the social worker's most appropriate action? A. Refer the former client to another social worker due to a potential dual relationship. B. Politely greet the former client if encountered, but avoid personal conversation. C. Acknowledge the former client's presence and offer to be a business reference. D. Move their office to a different location to avoid any perception of impropriety. Answer: B. Politely greet the former client if encountered, but avoid personal conversation. This question tests the social worker's understanding of boundaries and the post-termination relationship in private practice. When a former client appears in an incidental, non-therapeutic context, the most appropriate action is to maintain professional boundaries by offering a polite, brief, and impersonal greeting if encountered, while avoiding any personal conversations or behaviors that could re-establish a therapeutic or dual relationship. This acknowledges the person without compromising professional ethics or the terminated therapeutic relationship. For example, a simple hello or nod is sufficient. It is impractical and unnecessary to move offices or initiate referrals for an incidental encounter. Question 15. A social worker is developing a care plan for an elderly client recently discharged from the hospital after a fall. The client lives alone and expresses fear of falling again. What is the most important factor for the social worker to consider when developing this plan? A. The availability of local home health services. B. The client's preferences and goals for their care. C. The cost-effectiveness of various intervention options. D. The family's recommendations for the client's living arrangements. Answer: B. The client's preferences and goals for their care. This question emphasizes the core social work principle of client self-determination and person-centered planning. When developing a care plan, especially for an autonomous adult, the most important factor to consider is the client's own preferences, values, and goals. A plan that does not align with the client's wishes is unlikely to be followed and undermines their autonomy. For example, if a client values independence over moving in with family, The plan should focus on supporting independent living with necessary modifications. Always prioritize the client's voice in their own care decisions to ensure engagement and ethical practice. Question 16. A social worker is leading a bereavement support group. During a session, a member reports feeling overwhelmed by grief and states, "I don't know how much longer I can bear this pain." What is the social worker's best next step? A. Facilitate a discussion among group members about coping with intense grief. B. Acknowledge the member's pain and assess for suicidal ideation. C. Advise the member to seek individual counseling to process their grief. D. Reassure the member that these feelings are normal in the grieving process. Answer B. Acknowledge the member's pain and assess for suicidal ideation. This question tests the social worker's ability to recognize and respond to potential signs of elevated risk within a group setting. While intense grief is normal, the statement, "I don't know how much longer I can bear this pain," can be a subtle indicator of despair and potential suicidal ideation. Therefore, the best next step is to acknowledge the member's emotional pain and then conduct a brief, discreet assessment for suicidal thoughts, asking directly about their safety. For instance, the social worker might say, "That sounds incredibly painful. Are you having any thoughts of harming yourself?" This prioritizes safety while still maintaining the group's supportive atmosphere. Question 17. A social worker receives a referral for an adolescent client presenting with recent academic decline and withdrawal from peers. The social worker suspects the client may be experiencing early symptoms of a mental health disorder. What is the social worker's most appropriate initial action? A. Conduct a thorough biopsychosocial assessment. B. Recommend the client be placed in a special education program. C. Facilitate a family therapy session to address family conflict. D. Provide the client with coping skills for stress management. Answer A. Conduct a thorough biopsychosocial assessment. This question emphasizes the foundational importance of a comprehensive assessment in social work practice, especially when symptoms are new or unclear. When a client presents with a constellation of symptoms that suggest a potential mental health disorder, the most appropriate initial action is to conduct a thorough biopsychosocial assessment. This comprehensive evaluation gathers information across biological, psychological, and social domains to understand the full scope of the client's situation and inform an accurate diagnosis and treatment plan. For example, the assessment would explore family history, developmental milestones, peer relationships, and any medical conditions. Without this assessment, interventions might be misdirected. Question 18. A social worker in a hospital setting is working with a client who has been deemed medically stable but is experiencing homelessness and has no safe discharge destination. The client states, "I just want to get out of here, I'll figure it out." What is the social worker's most ethical next step? A. Discharge the client with information about local homeless shelters. B. Engage in advocacy to secure a safe and appropriate discharge plan. C. Inform the client that they cannot be discharged until a safe place is found. D. Document the client's refusal of services and discharge them. Answer B. Engage in advocacy to secure a safe and appropriate discharge plan. This question addresses the ethical responsibility of social workers to ensure client safety and well-being, particularly in vulnerable situations. When a medically stable client faces homelessness upon discharge, the most ethical next step is to engage in robust advocacy to secure a safe and appropriate discharge plan, rather than simply discharging them to the streets. This reflects the social work commitment to social justice and ensuring basic human needs are met. For example, the social worker might connect with various community resources, housing programs, or negotiate with the hospital for an extended stay while solutions are sought. Discharging to homelessness without exhausting options goes against core social work values. Question 19. A social worker is meeting with a mandated client who frequently cancels or arrives late for appointments, expresses skepticism about therapy, and remains largely silent during sessions. What is the social worker's best initial approach? A. Confront the client about their lack of engagement and attendance. B. Explain the benefits of therapy and the importance of participation. C. Explore the client's resistance and their understanding of the mandate. D. Terminate services due to the client's lack of motivation. Answer: C. Explore the client's resistance and their understanding of the mandate. This question focuses on engagement strategies with mandated or resistant clients. When a client exhibits resistance through cancellations, tardiness, or silence, the best initial approach is to explore the underlying reasons for their resistance and their understanding of the mandate for therapy. This client-centered approach helps to build rapport by acknowledging their feelings and challenges, rather than confronting them directly or lecturing them. For example, the social worker might ask, "It sounds like coming here might feel difficult, or perhaps you're not sure why you're here. Can you tell me what you understand about why the court asked you to come?" This can uncover barriers to engagement and foster a more collaborative relationship. Question 20. A social worker working in a school setting learns that a 10-year-old student has consistently been coming to school without lunch or money for food, and often appears tired and withdrawn. What is the social worker's most appropriate first action? A. Provide the student with lunch money for the day. B. Refer the student to the school's free lunch program. C. Contact the student's parents to discuss the situation. D. Assess the student's overall well-being and family circumstances. Answer: D. Assess the student's overall well-being and family circumstances. This question tests the social worker's foundational skill of comprehensive assessment, especially when multiple concerns are present. While providing lunch or referring to a program addresses an immediate need, the most appropriate first action is to conduct a broader assessment of the student's overall well-being and family circumstances. The lack of food, tiredness, and withdrawal could indicate neglect, poverty, or other family stressors that require a holistic understanding to provide effective and sustainable support. For example, the social worker might speak with the student, teachers, and if appropriate, the parents, to gather more information about the home environment and resources. This ensures that interventions address the root cause, not just the symptoms. Question 21. A social worker is supervising a new intern who discloses that they recently started dating a former client whom they terminated services with 2 months ago. What is the social worker's first action? A. Advise the intern that this is an ethical violation and they must end the relationship. B. Report the intern to the state licensing board immediately. C. Review the ASWB Code of Ethics with the intern regarding dual relationships and post-termination boundaries. D. Discuss the intern's rationale for entering the relationship and the perceived benefits. Answer: C. Review the ASWB Code of Ethics with the intern regarding dual relationships and post-termination boundaries. This question addresses the supervisor's ethical responsibility in guiding an intern through a potential ethical violation. When an intern discloses an inappropriate relationship with a former client, the first action of the supervisor is to educate and guide them by reviewing the relevant sections of the ASWB Code of Ethics concerning dual relationships and appropriate post-termination boundaries. This didactic approach provides necessary professional development and clarifies ethical expectations before considering more punitive actions. For instance, explaining the standard typically requiring a significant time lapse, e.g., 5 years, and the inherent power imbalance. This helps the intern understand the gravity of the situation and learn from their mistake within a supportive framework. Question 22. A social worker is working with a client who presents with severe anxiety, consistently canceling appointments at the last minute due to their anxiety, making it difficult to leave home. The client expresses a strong desire to continue therapy but struggles with attendance. What is the social worker's most appropriate next step? A. Terminate services due to the client's inability to consistently attend. B. Refer the client for an intensive outpatient program. C. Explore options for telehealth or home-based sessions with the client. D. Impose a cancellation fee to encourage better attendance. Answer: C. Explore options for telehealth or home-based sessions with the client. This question tests the social worker's flexibility and commitment to client engagement, especially when faced with practical barriers to treatment. When a client expresses a strong desire to continue therapy but is consistently hindered by their primary issue, severe anxiety leading to agoraphobia-like symptoms, the most appropriate next step is to explore adaptive solutions like telehealth or home-based sessions. This demonstrates client-centered care by removing barriers to access and accommodating their needs, rather than terminating services or imposing punitive measures. For example, offering a video session might allow the client to participate from their comfort zone. This approach helps maintain the therapeutic relationship and allows for continued progress. Question 23. A social worker is providing services to a family experiencing acute homelessness. The family includes 2 young children, and the parents are overwhelmed and visibly stressed. What is the social worker's most important first step? A. Connect the family with resources for long-term housing solutions. B. Focus on helping the parents develop stress management techniques. C. Assess the immediate safety and well-being of the children. D. Facilitate a family meeting to discuss their feelings about their situation. Answer: C. Assess the immediate safety and well-being of the children. This question highlights the paramount importance of child safety and mandated reporting. When working with a family experiencing homelessness, especially with young children, the most important first step is to assess the immediate safety and well-being of the children. Homelessness significantly increases the risk of neglect, exposure, and other harms. The social worker must ensure that the children are safe, have adequate food, shelter, and are not experiencing abuse or severe neglect before addressing other issues. For instance, the social worker would inquire about sleeping arrangements, access to food, and any health concerns for the children. This ensures the protection of vulnerable minors, a primary ethical duty. Question 24. A social worker receives a direct payment from a client for services rendered. The client subsequently finds a new job and wishes to transition to using their health insurance for future sessions. What is the social worker's next action? A. Continue to accept direct payments to maintain consistency. B. Inform the client that once a payment method is established, it cannot be changed. C. Discuss with the client how to transition to using their health insurance benefits. D. Refer the client to an in-network provider to accommodate their insurance. Answer: C. Discuss with the client how to transition to using their health insurance benefits. This question addresses the social worker's responsibility to facilitate client access to care and accommodate changes in their circumstances. When a client's financial situation changes and they express a desire to utilize their health insurance, the next action is to collaboratively discuss and facilitate that transition. This involves explaining the process, any necessary paperwork, and verifying coverage details. For example, the social worker would explain how to submit claims, or, if in network, how the billing process will change. This supports client self-determination and ensures they can continue to access services using their preferred and newly available payment method. Question 25. A social worker is conducting an intake assessment with a new client who identifies as transgender and expresses feeling misunderstood by previous mental health providers. What is the social worker's most important initial approach to establishing rapport? A. Focus on quickly identifying a diagnosis and treatment plan. B. Educate the client about gender identity and affirmation. C. Use gender-neutral language and ask about the client's preferred pronouns and name. D. Share personal experiences of working with transgender clients to build trust. Answer: C. Use gender-neutral language and ask about the client's preferred pronouns and name. This question highlights the importance of cultural competence, respect, and affirming practices in establishing rapport with transgender clients. When a client identifies as transgender and has experienced prior misunderstanding, the most important initial approach is to immediately demonstrate respect and affirmation by using gender-neutral language and directly asking about their preferred pronouns and name. This simple yet profound act validates their identity and creates a safe, inclusive therapeutic space. For example, using they/them until informed otherwise, and asking, "What name and pronouns do you prefer I use?" This foundational step is critical for building trust and ensuring the client feels seen and respected.